Hello everyone, how's it going? Today we are going to overview the entire cardiovascular system. We're going to talk about the different blood vessels. We're going to talk about how blood flows throughout the circulation. We're going to talk about components of blood itself and sort of the purpose and the functions of the cardiovascular system. So first, we have a lot of learning objectives for today. We're going to learn all about the cardiovascular system and the different blood vessels and how they're arranged, and sort of the purpose of the cardiovascular system and different relationships today. But before I do that, being that this is the first lecture of this semester, I do want to sort of describe this all in a brief review before going a little bit more into detail. Keep in mind, I will be discussing more of these topics in depth as we go on week by week. But today we are basically just going to overview the whole entire system and the purpose and functions of our cardiovascular and cardiopulmonary system. In this figure, we could see an outline of our cardiopulmonary system. This system will supply blood to different areas of the body, and that is very useful for many different functions because blood is going to help transport oxygen. That's important for aerobic respiration and metabolism. It's going to transport different hormones that help dictate many functions. It's going to help transport certain cells, including white blood cells that play a role in the immune system. It's going to transport platelets, which help the repair of damaged vessels. It's going to transport different nutrients and different waste products, different ions. So the blood is very important. I forgot too, temperature regulation. So the blood serves many different purposes in our body. And so that blood is going to travel amongst a large network of blood vessels. And so here we see that right in the middle is our heart. And the heart is the pump that creates the pressure necessary to drive blood flow. The left side of the heart, shown here, is going to pump oxygenated blood from this left ventricle out into the aorta and out into the arterial circulation. Arteries will become smaller arteries and then will branch into resistance vessels known as arterials before getting to the microcirculation of the cells of these different organs. And so here in this microcirculation, otherwise known as the capillaries, there's going to be exchange of O2 and CO2 and different nutrients and different wastes. And then once that oxygen is dumped off at these different cells, that blood, now deoxygenated venous blood, is going to make its way through the venous circulation back to the right side of the heart. And so that venous blood is going to be dumped from the vena cava, the inferior and superior vena cava, not shown here, but these are just the vessels that will transport this venous blood to the right atrium. And then from the right atrium, this deoxygenated blood enters the right ventricle, and the right ventricle pumps that blood to the lungs, where the blood is then oxygenated, CO2 is dumped off, oxygen will then bind to hemoglobin, the blood turns more red because of this. It is now oxygenated with a higher pressure of oxygen and then makes its way to return back to the left side to continue the process again. We have many different variables that we are concerned about when it comes to the cardiovascular system. One of the most important ones is blood flow, because we want to ensure that the blood is being distributed properly across the body in order to make sure that different functions are going to behave properly at rest. And so blood flow is going to be dictated by delta P, or what's known as the differences in pressure, over resistance. And so pressure is, or delta P, is basically the initial pressure minus the ending pressure. And the bigger the difference of those two pressures, the greater the blood flow. So for example, our blood flow across the circulation is going to have the highest pressure in the left ventricle and the lowest pressure near zero pressure or zero pressure at the right atrium. And so the greater the difference between the pressure in the left ventricle and then the right atrium is going to mean more blood flow across the circulation. And so that blood flow, as far as our total cardiovascular system is concerned, is dictated by cardiac output. So again, the left ventricle, the heart, is supplying the pressure necessary to have blood flow across the entire circulation. In addition, vessels each are going to have resistances to blood flow. And like I said in the beginning, we're going to talk more about this in detail in later lectures, but that resistance is dictated by the size of our blood vessels, and in particular, the radius or diameter of those blood vessels. And so both pressures and resistances are going to dictate blood flow throughout the body. So when it comes to our cardiovascular system, we are always concerned about our blood pressure. And now each blood vessel is going to have its own pressure that's exerted against the walls of that vessel. However, we typically are concerned about the arterial pressure because that is the driving pressure throughout the entire circulation. And so our body, it has these receptors called baroreceptors that are constantly monitoring the pressures within our circulation. And many times blood flow is going to be dictated by what's called mean arterial pressure, or the average pressure across the arterial circulation. And that's going to be dictated by the blood flow or the cardiac output, how much blood is being ejected from the heart, multiplied by what's called the total peripheral resistance. Our blood vessels are set up in series and parallel circuits. Series circuits means that the blood has to travel from one destination to the next in one continuous series. However, a parallel circuit is when blood vessels will branch in different directions so blood flow can be distributed across different areas of the body. In general, the circulation is set up in a parallel circuit. This means that blood that leaves the left ventricle and makes its way to the aorta and the arterial side of the body, those arteries are going to branch out. And therefore, that, let's say, blood heading to the legs does not need to be collected from all of the organs above it. And so these parallel vascular networks ensure that blood can be distributed amongst all or different areas of the body all at once. One example of a series circuit is the gastrointestinal system. And so blood supplied to the gastrointestinal organs via these different arteries are going to deliver this oxygenated blood to the spleen and the stomach and all these different organs. Nutrients and oxygen and CO2 will be exchanged. And then within that same series, that blood is then delivered to the liver. So this is an example of blood having to go to one destination in a series and then to the next destination within that same series. We'll talk about this more in detail when we discuss hemodynamics, but the parallel arrangement of our circulation allows for better and more concise control of blood flow. For example, let's say we are exercising. So at the moment, we will not need, or it's not a high priority to deliver a lot of blood flow to areas like the gastrointestinal system and the renal circulation. And so instead, we could take the blood that was going from those areas and then deliver it to the skeletal muscles and the heart in order to keep up our intensity of exercise. And so this is just, again, one benefit for a parallel series that you could better choose and better control blood flow throughout the body depending on what the need is at that current time. And also it provides a lower resistance compared to a series arrangement. The total resistance of a parallel circuit is equal to the reciprocal of the individual resistances, while in a series resistance, total resistance is determined by each individual resistance. Again, that sounds confusing for right now. We'll talk a little bit more about it when we discuss hemodynamics, but basically, for now, just keep in mind that in a parallel circuit, resistance is lower. So blood is delivered from the left ventricle into the arterial circulation. And this arterial side has a higher pressure of oxygen within that blood. And so that blood is then delivered to the different cells and the different organs of our body. And then in these cells, we have a lower pressure of oxygen. So O2 is dumped off from the hemoglobin, from the red blood cells, to these cells. And that happens in vessels called capillaries. And so this is the site for gas exchange. Oxygen in the systemic circulation is going to be dumped off again from those red blood cells to the cells to be used for aerobic respiration. CO2 will go from those cells into the capillaries and into the bloodstream. And then now that blood that leaves those cells and leaves those organs is deoxygenated, meaning it has less pressure of oxygen within that venous blood, and now it has a higher amount and higher pressure of CO2. And then that venous blood will travel its way from venules to veins, making its way back to the vena cava and the right side of our heart, which will be pumped to the lungs to be oxygenated. And this cycle continues for every minute that you are living. We have many different types of blood vessels throughout the circulation. We have what's called macrovessels, which are large conducting vessels. These include the arteries, the veins, the aorta, the vena cava, and so throughout the body, a lot of these arteries and veins are named based on where that blood is traveling to or from. So, for example, the brachial artery, since it's on the arterial side, that's the blood vessel delivering oxygenated blood to the arm. The aorta, we know, is where blood is collected from the left ventricle to be distributed out to the arterial side. We also have here an example of the femoral vein. So that is a vein within the leg that's going to help collect blood flow and return it back to the heart. The vena cava, which is, we have the superior inferior vena cava, which help bring blood back into the right atrium, venous blood. And so these all are going to have a larger diameter, low resistance, thick walls, and are going to be more elastic than smaller vessels. We also have many microvessels throughout the circulation, which include the arterioles, the capillaries, and the venules. Arterioles are basically smaller artery blood vessels that deliver arterial blood to the certain cells of different organs. The capillaries, again, is where O2 and CO2 exchange takes place, where nutrient and waste exchange takes place, and then venules are tiny veins that help deliver blood back to the venous side. So the thing about these vessels is that they are, again, smaller, have a smaller radius, and have a increased resistance within those vessels. In particular, the arterioles are going to contribute the most to total peripheral resistance. They, again, have a large amount of smooth muscle which surrounds the lumen. And that's why these are the main vessels when it comes to changing blood pressure and changing resistance. These are the vessels that are going to contribute the most, and that's why arterioles are otherwise known as resistance vessels. And so when there needs to be an increase in resistance or pressure, there will be signals that increase vasoconstriction, that is making the lumen or diameter of those arterioles smaller, and that therefore again increases resistance and pressure, also cutting off blood flow to whatever area that arteriole is leading to. Or if there needs to be a decrease in resistance and pressure, those there will be signals to relax that smooth muscle surrounding arterioles, and that will help increase blood flow to the area, but also, again, decrease resistance and pressure. Let's talk a little bit more about the differences across all these different kinds of vessels. In particular, we'll talk a little bit about the pressure, velocity, and cross-sectional area of each. So first, starting with the aorta and the large arteries, so these bigger arterial vessels, there is the highest amount of pressure and greatest amount of blood velocity. And so we see right at the beginning, since these arteries and the aorta in particular are right next to that left ventricle, when that blood is ejected from that left ventricle, that high pressure of blood, that's going to translate to high pressures, again, within the aorta and within the arteries. And then as we go from the arteries to the arterioles, to the capillaries, to the venules, to the veins, that pressure decreases throughout the systemic circulation. In addition, the pressure within the arteries, we can see, is going to be dictated by the beat of the heart, and that is what's meant by pulsatile, because it's going to depend on the phase of the heart, whether systolic or ejecting, or diastolic relaxing, and that is going to dictate how much blood pressure is within these arteries. It's important to note that liquids and gases travel from places of high pressure to places of low pressure. And so we're seeing in this chart that the pressures throughout each of these vessels are what dictate blood flow. So blood is ejected from the left ventricle, is going to be very high pressure within the aorta and the arteries, and will decrease less and less and less till it eventually gets back its way through the venous circulation back to the vena cava in the right atrium, where pressures are very low, and this is what allows blood to flow throughout the entire circulation. In the resistance vessels, capillaries and venules, we see that this pressure is decreasing, and we see that it is less dependent on the phase of the heart, especially as we get past the capillaries into the venous circulation, because it's just so far removed from the phase of the heart that the systolic or diastolic phase really doesn't dictate the resistance and pressure within those vessels. We also want to note about blood velocity, or the speed that the blood is traveling through each of these vessels. Now, blood velocity is going to be dictated by blood flow and what's called cross-sectional area. And so in a place like the aorta, there is a high amount of blood flow because it's receiving all of the blood from the left ventricle. So we have high pressures, high blood flow. But at the same time, this is a very small vessel. It's only around a cross-sectional area of 4 centimeters squared, so a very, very small vessel, but it's collecting this large volume of blood, so that means that we're going to have a high velocity of blood flow. And so basically, as we go through the circulation, what we're going to see is that blood velocity is inversely related to cross-sectional area. And so there's a higher cross-sectional area of arteries than the aorta, then there's a higher cross-sectional area of arterioles than compared to the arteries, and then the greatest cross-sectional area out of all the vessels within our body are the capillaries. And if you think about why, there are trillions of cells throughout the body, which are most going to need blood supply. And so we need to form a lot of these little capillaries, have a high cross-sectional area in order to distribute that blood to those cells. And so the fact that there is a high cross-sectional area in those capillaries means that those capillaries have the lowest blood velocity. But when you think about it, that's sort of a good thing, because the capillaries are the site, again, of exchange of oxygen, of CO2, of nutrients and waste. And so you really don't want a high velocity because you want enough time in order to basically distribute, in order to exchange those different materials at those capillaries of those cells. And so overall, just reviewing this slide, the highest pressure is going to be within the aorta and the arteries, which are dictated by the phase of the heart. Once the heart is ejecting blood, that means that blood pressure and blood flow is going to be higher in the arteries. And then as we go from the arteries to arterioles, there is the greatest reduction in pressure drop. Then we get to the capillaries, where there is this very low blood velocity, but exchange of different materials through the circulation in the cells. And then pressure drops as we head to the venules, and then makes its way back to the veins and the vena cava for the cycle to all start again. Most of the blood volume is stored within the peripheral circulation, meaning the blood vessels of the body. There's only around 7% of blood that is stored in the heart at rest. And so at most times, 60 to 70% of our total blood volume is located within the venous circulation. So 2/3 of our blood volume at rest is within this venous side. And most of that is going to be located below the heart. And the reason for that is because gravity pulls down that blood towards the lower vessels. And the reason why most of our blood is stored within the venous circulation is because that these vessels are highly compliant, meaning that they can store large volumes of blood without a large change in pressure. The walls of the venous vessels will stretch as they take on more blood volume, and that is why they are more compliant. They're allowed to take on these larger quantities of blood without increasing pressures. This is different than the arterial circulation, the arteries in particular, which are more elastic. And so as they take on more blood volume, those vessels are going to snap back. And that actually helps drive blood flow forward. But again, in the case of the venous circulation, they will be able to collect more blood volume, and that is why they are the reservoir of our cardiovascular system. Remember, the blood has many different functions, but one of the most important functions is to deliver oxygen to the metabolically active cells within our bodies. 99% of the oxygen that travels throughout our blood is bound to red blood cells on the protein called hemoglobin. And so we want to know how oxygenated the blood is. We would want to know what percentage of hemoglobin are bound to O2. And so this is called hemoglobin saturation. Now, many of you may have seen what's called a pulse oximeter, which is typically placed on your index finger and will tell you that hemoglobin saturation. Now, typically, you want to be above 95% saturation, and this has even been a little bit more, as far as like information about this has been talked about a little bit more because of COVID-19 and that diseases impact on our oxygen saturation, which can be troubling. But basically, the hemoglobin saturation tells us how much oxygen is bound to hemoglobin. And this is going to be dictated by the partial pressure of oxygen in the area of the body. So for example, if we're talking about the lung, the partial pressure of oxygen in the lungs are very high because we're taking in air from the atmosphere, and that contains oxygen, and so there's going to be a high concentration of oxygen within our lungs. And so blood vessels, the circulation of the pulmonary system, we are going to have a high amount of oxygen that's bound to hemoglobin due to the high partial pressure of oxygen within those lungs. And so that's why the arterial blood is going to have a partial pressure of oxygen of around 100 mmHg. And now that arterial blood is going to have most of the oxygen, most hemoglobin bound to oxygen, and then it's going to travel and make its way to different cells of the body. Now, in the different cells of the body, intracellular PO2 is very low, roughly around 40 mmHg. And so oxygen then is going to disassociate from hemoglobin, from these red blood cells, and travel into the cells where it will be used for aerobic metabolism. And so that is the relationship that's described here, where what percentage of hemoglobin are bound to oxygen is dictated based on the partial pressure of oxygen located within that area of the body. Like I alluded to earlier, not only is the movement of liquids such as blood dictated by pressures, but the movement of gases is also dictated by pressures. So looking at it again and just thinking about it a little bit deeper, we breathe air in, there's a high concentration of oxygen within the lungs, and then blood is going to come from the right ventricle and make its way up to our pulmonary circulation. And this blood coming from the right ventricle is venous blood. It contains a lower partial pressure of oxygen. So when that blood with a lower partial pressure makes its way to the lungs, that oxygen is going to travel from the lungs across the alveoli and attach itself to the hemoglobin within that blood. That blood then becomes oxygenated, makes its way back to the heart, and that arterial blood is then pumped to many different cells. That blood containing now a higher partial pressure of oxygen makes its way to cells, which contain a lower partial pressure of oxygen because those cells are using that oxygen, using it for metabolism. So there's not a lot of oxygen located within the cells themselves. And when arterial blood makes its way to those cells, oxygen travels from the higher pressure in the arterial blood to the lower pressure within those cells, and that is how oxygen is going to move from the blood to the different cells of our body. Now, there are other factors that can also impact the affinity of oxygen to hemoglobin, or the strength of binding from oxygen to hemoglobin. And those include temperature, carbon dioxide, what's called biphosphoglycerate, a product of metabolism, and then the level of hydrogen ions. And so if there is an increase in temperature, if there's an increase in CO2, if there's an increase in biphosphoglycerate, or if there is an increase of hydrogen ions within the blood, aka lower pH, that is going to decrease the affinity of oxygen to hemoglobin. Now, let me give you an example that relates this a little bit better. During exercise, you could look at these factors and determine that temperature is going to go up, right? You sweat during exercise, you're breaking down more nutrients, you're releasing more heat, so temperature goes up. Through that increase in metabolism, you're also producing more CO2 at those skeletal muscles. Glycolysis is increasing because you need that energy in order to perform that exercise. So you're going to get an increase in biphosphoglycerate. And you're also, through those reactions, through those chemical reactions, producing more hydrogen. So within the blood vessels surrounding your skeletal muscles, within your skeletal muscles, you're going to see this increase in temperature, this increase in CO2, increase in biphosphoglycerate, and a decrease in pH. And what is that going to do during exercise? So when blood makes its way from the lungs now to the different skeletal muscle cells, the fact that these things that I talked about have changed now means that more oxygen is going to disassociate from hemoglobin and make its way into cells. And this is a good thing, right? Because we need oxygen to keep our exercise, to keep our physical activity going. This rightward shift of the oxygen dissociation curve is called the Bohr shift. And again, this happens during exercise. And so when temperature and CO2 and biphosphoglycerate all increase, and when pH decrease, we get more oxygen dump off, right? So at the same partial pressure of those cells, roughly around 40 mmHg, we are going to get more oxygen getting dumped off into those cells. Those cells can then use that oxygen to increase aerobic metabolism. Now, there are also leftward shifts of this curve as well, and this is going to increase the affinity of hemoglobin for oxygen. And so if temperature decreases, if CO2 decreases, if biphosphoglycerate decreases, or if pH increases, aka less hydrogen ions are being produced or within that bloodstream, then we get more oxygen bound to hemoglobin, more oxygen bound to those red blood cells. So that's it. That is a brief overview of our cardiovascular system. Over the next few weeks, we're going to get a little bit more detailed with the topics that I discussed today. We're going to talk more about formulas, more about pressure, more about resistance, and how this all impacts our cardiopulmonary physiology. Thank you guys so much, and I'll see you next lecture.